Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Adamawa State completes administration of second dose of Oxford AstraZeneca COVID-19 vaccine. Later on the program, we take a look at how COVID-19 has affected economies and livelihoods, as well as lessons learned. And a month and a half to the Tokyo Olympics, Japanese Prime Minister lifts state of emergency over Tokyo and 8 other places. The International Monetary Fund, IMF, says Nigeria's economy is recovering gradually from the negative impact of COVID-19, but noted that both unemployment and inflation rates remain elevated. The IMF, in a statement at the end of its virtual meetings with the Nigerian authorities to discuss recent economic, financial developments and outlook, described the recent removal of the official exchange rate from the Central Bank of Nigeria's website as encouraging. The IMF mission said following the sharp output contractions in the second and third quarters, GDP turned positive in Q4 2020 and growth reached 0.5% year-on-year in Q1 2021, supported by agriculture and services sectors. Well, this is as last night, reports from the NCDC shows 45 patients were discharged, the highest recorded since the beginning of the week. And thankfully, no death has been recorded for the 12th day. Let's take a look at the report.
Non-pharmaceutical interventions, including proper hand washing, remains an effective strategy in curbing the spread of COVID-19. The Nigerian Center for Disease Control, NCDC, is reiterating this and advising all to ensure they wash or sanitize their hands frequently. Meanwhile, Nigeria's daily count of new infections recorded a significant decline, with only 8 samples confirmed positive from 3 states in the last 24 hours. Rivers topped the list with 4 cases. FCT recorded 3, while 1 case was recorded in Kwara. The agency also reported 0 cases from Imo, Kaduna, Kano, Nasarawa, and Sokoto. Nigeria now has a total of 167,103 confirmed cases. 45 people have also been discharged after testing negative, raising the number of recoveries to 163,528. Till date, the fatality toll in Nigeria stands at 2,117. The latest update by the National Primary Healthcare Development Agency shows that almost 2 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while more than 730,000 of those vaccinated with the first dose have now received their second. In the second phase of the exercise, Lagos is taking the lead after vaccinating over 128,000 of its target population, followed by Oyo and the FCT. In Africa, there are over 5 million confirmed cases of COVID-19 and more than 136,000 deaths on the continent. Globally, there are more than 177 million confirmed cases, while deaths have surpassed over 3.8 million.
Successful is what the Adamawa state government is describing the administration of the second dose of the AstraZeneca vaccines allocated to the state. According to the executive secretary of the state's primary healthcare development agency and a member of the state's containment committee, the state is set to commence the next phase, which is for those who are yet to get the first dose of the vaccine. He also applauds the efforts of health workers in the various COVID-19 command centers across the state.
Adamawa State in northeast Nigeria has lower rates of COVID-19 infection than many others in the country. Health officials attribute this to active mechanisms to tackle community transmission and vaccine hesitancy safety awareness campaigns. The State Commissioner for Health and Human Development, Professor Abdullahi Issa, says the campaign is yielding results as people are turning up for their vaccinations.
It has been generally accepted by the people of the state because, as you can see, the multitude of people behind me that are receiving the COVID-19 vaccines, this shows that the vaccine has not been rejected as it happens in other states. It's well accepted in Adamawa State.
The state's strategy, according to the Executive Secretary of the Primary Health Care Development Agency, Dr. Bashiru Suleiman, has enabled it to give services beyond its borders.
We even assisted some states who couldn't do well in the first dose. We collected 14,550 doses and we vaccinated them in Adamawa State. Adamawa State government has done some community mobilization and people are coming out in their numbers. And now we are getting increasing cases of need for first dose.
He also says that the state has achieved 50% vaccination coverage, and if it should experience a cholera outbreak from one of its neighbors, the mechanism already in place to fight COVID-19 will be useful in nipping that in the bud.
And not long after the index case of COVID-19 was detected February 27, 2020, and community transmission took hold, it began to dawn on most Nigerians that the country was facing a serious health threat. What did not immediately become clear was how it would affect the country's economy and, beyond that, the livelihoods of the ordinary citizen. This report by Mary Alele Yusuf gives a peek into the disruption the outbreak caused and the daily living in Nigeria.
At first, it looked like people traveling into the country with the only COVID-19 threat. Though tasking, it was straightforward enough to register their temperatures and travel history and to monitor their movements for the incubation period, which was then pegged at 14 days. But in a matter of weeks, transmission paths could no longer be traced. People without travel histories were coming down with the immune system weakening disease. Lockdown meant the end of business as the world knew it.
India and a few other countries in Asia banned the export of active pharmaceutical ingredients to other countries. And what that meant was that the supply chain for drugs which are produced in Nigeria and other countries were severely threatened.
It was not only the pharmaceutical sector that suffered. Currently, business is booming at the Muritala Mohammed Airport as newly disembarked passengers look for taxis to their various destinations. This is in stark difference to late March of 2020, when most air traffic was stopped to control the spread of the novel coronavirus.
We just manage the little we have in our purse.
We start calling each other that if you are buoyant, please try and help others.
That's where food packs, bought with monies provided by a private sector-led organization in Nigeria, COVID, and international bodies were disbursed to reduce hardship. But it did not always get to where it was needed at the right time.
After COVID-19 have come to an end and everyone had the same job, we're back at the airport is open, so we get a little palliative from government.
Experts in pharmaceuticals hope for more medicine security, which could have mitigated the blow COVID-19 dealt the industry.
Based on this realization that we all need to become stakeholders in ensuring medicine security for our people, there is now an increased interest in local pharmaceutical manufacturing. And so you've had things like the CBN bringing up 100 billion naira single-digit loans for the pharmaceutical manufacturing sector. You've had them bringing up a multi-billion naira grant for research.
Now cases are down, the lockdown has been eased, and businesses are starting to pick up again. Until it's all over, if ever, vaccines could provide immunity, and before herd immunity is achieved, mask wearing, physical distance observation, and hand washing cannot grow old. Mary Alele Yusuf, Channels Television News.
Well, for more, Dr. Boduri Astikomaya, consultant hematologist, blood transfusion specialist, executive secretary, Lagos State Blood Transfusion Service, and team lead COVID post-recovery. She joins us now via Zoom. Thank you for joining us on the program.
Thank you very much.
First, let's get your view of the pandemic fight in the country, looking at, where we're coming from, where we are, and what you think that we can do a lot better.
Well, personally, I think a lot has been put into the COVID response. And in getting things better, I feel that we need to maintain or actually improve on the services that are available now. All the healthcare facilities that are being upgraded should be maintained. Doctors and healthcare workers that have been trained should continue to have their training so that when another wave comes in, we'll be prepared to act against it.
Now, Lagos was badly hit with COVID-19, and as one who works in Lagos leading the COVID recovery, what were the difficulties that you experienced?
Well, there was people were afraid to come back to the clinic because they really did not want people to know that they had COVID. So they really kept to themselves from the time they were being diagnosed as having COVID-19 infection to even during the recovery phase. They really did not want to come out to tell us what they were going through until they became really bad. But as time goes on, when advocacy came up and we're able to actually demystify the things involved with the COVID infection, and people started coming into the clinic. And it was a really good one because you could know that the symptoms following the COVID recovery persisted for quite a while. So it was a good one on the long run.
What was the pandemic's impact on blood transfusion? I mean, recently we celebrated World Blood Donor Day. Do we have many patients who have the virus from moderate to severe needing blood transfusion?
Well, the truth is that following at the COVID pandemic, we had very few people coming in to donate blood. First of all, there was the fear of infection going out of their homes. And then the lockdown came in and people were unable to move around. And then there was a lot of uncertainty if the COVID-19 infected blood could be transfused to other people, or if people could have COVID-19 infection from blood transfusion. So initially, we had quite some gap in meeting up with the needs for blood transfusion in people in Lagos State. But as this time went on and there are lots of research, realized that there was no known case of COVID-19 infection following a blood transfusion. And this really went a long way to allay the fears of donors as well as the fears of people that are willing to receive the blood. And following this, it has also been quite difficult because the economy has been quite poor and a lot of donors felt that they were not in a good economic state, financially and health-wise, to come and donate blood, even though they were not paid to donate blood. But they felt that they were not well fed and well nourished because of the economy. So a lot of advocacy has been going on to let people know that despite the economic crisis, despite the pandemic, you can still donate blood.
All right, finally, before we let you go, the NMA is advocating for adequate legislation that will sort of guide blood transfusion medicine in the country. What's your take briefly on this?
We really do need to have a legislation to guide blood transfusion, both blood donation and blood transfusion. The whole process of blood donation and transfusion is a part of medicine. It's a very
Oh dear, we seem to have lost Dr. Asiko Maya there, giving us an update on, of course, blood donation when it comes to COVID-19. Well, thank you. Let's quickly go on a short break. And still ahead, South Africa returns to tighter COVID restrictions as cases surge. We have that and more in a moment. Welcome back. South Africa is currently seeing the beginning of a third wave of COVID-19 infections driven mainly by cases from its densely populated Gauteng province. Authorities say this is because of a deficit in population immunity and complacency in adhering to the non-pharmaceutical interventions. The situation has sparked a debate on whether children are better off with online learning at home or in schools.
We have got very rich scientific evidence in terms of COVID-19 in children. We know that children, even if they are susceptible to infection, the outcome of infection is mild, or or they don't even experience any symptoms at all. It's just asymptomatic. But the problem is actually children having to act as reservoirs and transmitters of infections because they will move infection from schools to back to their homes and to the communities. And this is where the problem is. So it is difficult to close the schools completely. But my feeling is that if you are in a province like Gauteng province, where some schools can actually afford to do online teaching, then that should be encouraged.
Our South Africa Bureau Chief, Betty Dibia, joins us now on the program. Hello, Betty.
Hi, Millicent. How are you doing?
Very well, thank you. Did government see, health authorities, did they see the third wave coming? What would you say were the major indicators?
Well, government is advised by a number of committees made up of scientists, various aspects of the science of what's going on. So government saw it coming when they were not too sure. But I know that some of the members of the committee, past and present, have been warning that something needs to be done because hospitalization is increasing before we started getting the high numbers that we have today. In the last 24-hour cycle, we had over 10,000, 13,000 plus, which is quite worrying. So government saw it coming, but because of the nature of what government is dealing with, nobody knew when exactly, like we experienced in December for the second wave, and we had astronomical numbers. They saw it coming. They've been trying to ramp up capacity regarding vaccines, as well as all that's being said about non-pharmaceutical interventions, people staying safe and acting more responsibly. But they did see it coming.
I'll come back to the vaccines, but then people, I guess, are reacting to some of the restrictions, that are now in place. But the debate about school children, online learning or at home or in schools, how is that going?
Some schools, what's on ground right now, while the debate is going on, some schools are doing online learning. They've asked when some teachers, teachers, according to the rollout plan, were not part of the frontliners that were part of the first phase of the vaccine rollout. So some schools where you've had records of pupils and teachers that have tested positive here and there, they've sent the children home. They're learning online. Gauteng is metropolitan, so you can say there's access to internet and the like. But there are other places like the Eastern Cape where you have a lot of rural areas where pupils may not have access. Some schools are still open. So the debate is going on you heard Professor Mpatlele there talking about whether or not they should go, and they are the researchers advising government, saying these are the reasons why we say, okay, some can stay and some cannot, just to make the larger grouping of families safer. But that's still ongoing, but some schools are open, some are not.
In terms of the vaccination, what is the current daily capacity of the government?
Well, there's capacity and there's reality. There have been hiccups along the line. But so far, if I'll just take the general look, so far almost 2 million people have been vaccinated and more to come. We're expecting another batch of J&J, although about 2 million, that's the Johnson & Johnson, about 2 million compromised batch from the US factory will have been destroyed or are going to be destroyed here in the country. But we're expecting more. Also, we're expecting the Aspen batch, which will be coming for the commercial rollout of the vaccination. About 30 million doses are being expected, apart from all other efforts that the government is doing. They're also looking at, now that the older people are being vaccinated now. Initially, there was the insistence of people registering online. But I see that some of the provinces like Gauteng, they're saying people can do walk-in and get vaccinated, because many people need help with registering online and use of internet and the like, and people are being asked to help the older people. But there have been hiccups, but they're moving on. They're moving on. Almost 2 million, but that's still a far cry from the 40 or 42 million that the government expects to have vaccinated by the end of the year.
All right. Our South Africa Bureau Chief, Betty Dibia, it's always good to see you. Thank you.
Thank you, Millicent.
Japan has unveiled plans to slowly ease the coronavirus state of emergency in Tokyo and several other prefectures in time for next month's opening ceremony of the Tokyo Olympics. Prime Minister Yoshihide Suga announced that the government will switch to quasi-emergency measures once the state of emergency expires Sunday. The looser restrictions would remain in place until July 11th, just 12 days before the start of the Olympic Games. Here's more on the global update.
Britain has reported another 9,055 coronavirus cases in the last 24-hour period, the highest daily increase they've seen since February. Earlier in the week, Prime Minister Boris Johnson announced a 4-week delay to the final step of England's roadmap out of COVID-19 restrictions until July 19, amid a surge in cases of the Delta variant. In France, citizens are feeling freedom as it lifts the mask-wearing requirement outdoors. Mask requirements at work and in businesses are still enforced. Meanwhile, Disneyland Paris theme park opened its doors to visitors today after a 7-month closure. But safety measures requiring all guests over the age of 6 to wear a mask and social distancing will be enforced.
Good afternoon. I'm here with Dr. Bloomfield to set out the process and time.
New Zealand will take up to the end of the year to inoculate all those eligible for COVID-19 vaccinations. Prime Minister Jacinda Ardern has announced details of the country's vaccine campaign as the government faces criticism for a slow rollout of vaccines.
I can confirm that we will be rolling out the vaccine for the general population using age cohorts. That means it will help us manage both demand and supply, and also that we'll be able to communicate nationally when we're ready to start vaccinating the next age band.
The Japanese Prime Minister has announced that authorities are lifting a state of emergency for Tokyo and 8 other places, just a month and a half ahead of the Tokyo Olympics. Tokyo residents are expressing concerns over the government's decision, as many remain wary that the Games will spread the coronavirus. And finally, Spain's recovery plan after the COVID-19 pandemic and transformation into a greener and more digitalized economy got European Commission approval on Wednesday, the second such green light in the 27-nation EU. Indeed, after Portugal.
I'm very happy to announce that the European...
As one of the main beneficiaries of a $908 billion EU recovery scheme, Spain will get billions in grants until 2026 in an effort to revive its tourism-dependent economy.
Continue to take responsibility to protect yourself and others. You can take further look at our website. It has more updates, also a better understanding of the pandemic. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.